Hi, I'm Dr. Jason Loth with Nevy Health. Today I'm going to talk to you about a very fancy term that's out there all the time called arthritis. There's a lot of different types of arthritis that are out there. There's rheumatoid arthritis, juvenile arthritis, psoriatic arthritis, and many others. But the most common arthritis that we get to see on a regular basis is called osteoarthritis. And osteoarthritis is one of those arthritis conditions that a lot of people suffer from. And they suffer continually worse and worse and worse as they get older. Well, the problem is what we found is osteoarthritis a lot of times is caused by improper function of the joints, meaning that the joints either move too much or too little. Now, arthritis in a general sense means basically inflammation of the joint, if you break it down. And this inflammation of the joint comes from this either too much or too little motion within that joint. So at Nevy Health, what we do is we assess the joints, we assess the function to see what's going on with each individual and each individual's joints. Where there's lack of mobility within the joints, there are a lot of things that we can do to help to restore that mobility. Chiropractic care, flexibility with the muscles, massage therapy, spinal decompression to open spacing, and a lot of other therapies that we use here to help to restore function in those joints. Now, by restoring the function in these joints can help a lot of people alleviate a lot of their symptomatology, especially pain that can come from osteoarthritis. I'm going to show you today what the developmental phase of osteoarthritis is with this demonstration or this diagram right here. So if you look at a normal picture of an x-ray, and this top picture here is an x-ray of your neck. This first picture has a good curvature in it, and it has good spacing where the discs sit in between each of the vertebrae. As you can see this picture, that's a normal picture of your neck or your cervical spine. Now, as you go down that phase of arthritis or lack mobility, and in a general sense, arthritis in the spine is called spinal degeneration. And that degenerative phase, what happens over time is, second step is the spine starts to straighten out. As you can see this one, the spine gets straighter through here. And you can also see that the spacing where the discs sit are less. So this comes, and what this is called when your spine straightens is called kyphosis. It's a fancy term for straightening of the spine. So over time, that kyphosis sets in. And then from there, it starts to create spurs. What these are calcific buildup around the joints and the vertebrae in the spine, and this is a further process of the degradation of that spine. And then in time, it leads to possible fusion of the spine. So this is the progressive phase of how arthritis sets in when it comes to osteoarthritis for most people. Now, this can occur not only in the spine, but all the other joints of your body. So here at Nevy Health, we have a lot of different things that we do to help treat the symptoms that come from this dysfunction that lead to the pain from the arthritis, along with help people to hopefully avoid that by maintaining normal mobility, normal function of the joints, muscles, and the nervous system. So if you have any questions or have been told you have arthritis or want to prevent arthritis from coming about, seek us out at Nevy Health to see if there's something we can do to better your health and hopefully take care of your pain.